Good morning. Today is a demonstration class over the parotid gland. Parotid gland is present over a parotid mold, or you can say parotid bed, right? Here this area is representing you the parotid region. The parotid region, here I have used the clay, yellow color clay to represent the muscles. Please take them as muscle. This is masseter, this is your medial pterygoid, this is your posterior belly of digastric, this is your sternocleidomastoid, and medially there it is your styloid process, right? So let's begin with the boundaries of the parotid mold, right? In front there is a posterior border of the ramus of mandible. This is your ramus of the mandible, and this is the posterior border of the ramus of mandible with masseter over it and the medial pterygoid muscle posteriorly, which is attaching to the ramus. Now behind the posterior boundaries are formed by the mastoid process, and over the mastoid process there is an attachment of a muscle known as sternocleidomastoid, right? So this is your sternocleidomastoid. Now above there is an external acoustic meatus. There is an external acoustic meatus, and just in front of it there is a posterior part of temporomandibular joint. Down below this area is bound by a posterior belly of digastric muscle and a styloid muscle. The posterior belly of digastric is arising from the undersurface of the styloid process, right? So this is your posterior belly of digastric. And medially means inside, right? Medially there is a process called as styloid process, and over to it a lot of muscles get attached, and those are known as styloid apparatus. Muscle and ligaments attached to the styloid process called as styloid apparatus. So they form a medial boundary, and over to it your parotid, this is your parotid gland, right, resting over this parotid mold. Understood? Now let's see the boundaries, surfaces and the borders of parotid gland. This is your parotid gland, right? The parotid gland is largest pair of the three salivary gland, right? Submandibular and subsalivary gland. The parotid gland is the largest, and it is a inverted pyramid in shape, right? It is 25 grams in weight, and it is covered by a true capsule and a false capsule. We'll discuss later about the attachments of the lamella of this capsule, right? Now the presenting part, it has an apex, base, right, and borders and surfaces. So the apex is inverted and pointing downwards. The base is concave. It has anterior border, posterior border, and back side it has the medial border. This is your medial border. Now the surfaces. Let's talk about the surfaces. It has one superficial surface, right? And back side it has enteromedial surface and posteromedial surface. So in total it has how many borders? 3 borders: the medial border, anterior border, posterior border. And the surfaces, back and front is superficial surface. This is the superficial surface, right? And here enteromedial surface and posteromedial surface, right? One apex and one base. Now let's implant this parotid gland over your parotid region, and then we will see the boundaries and the surfaces relations. So here I have placed the parotid gland over this region. Clear? Now let's see first the apex. The apex is directed below and overlaps the posterior belly of digastric muscle. Now where is the posterior belly of digastric? I am removing it. This is the posterior belly of digastric. Over this muscle, this gland apex overlies this muscle, right? Now what are the structures which are passing through the apex? Well, first is the cervical branch of the facial nerve. The second is the anterior division of retromandibular vein. And the third is your formation of external jugular vein. This external jugular vein is formed by the posterior auricular vein and your posterior division of retromandibular vein. Now let's see quickly the base. The base is concave and it is related with the external acoustic meatus and the posterior part of the temporomandibular joint. Posterior part of the temporomandibular joint. Now what are the structures which are passing through the base? Right? The first, anterior to posterior, the first is your temporal branch of facial nerve, then superficial temporal vessels, and then auriculotemporal nerve. Clear? Now let's see the borders. The anterior border, which is intervening between the superficial surface and the anteromedial surface, which is behind to it. The anterior border is extending from the base to the apex. This anterior border, what are the structures which are radiating from the deep to this border, from above downwards, are the first is the zygomatic branch of the facial nerve, then transverse facial artery vessels, then upper buccal branch of the facial nerve, then the accessory parotid gland, then parotid duct, lower buccal branch of facial nerve, and in the last is the marginal mandibular branch of the facial nerve. Now let's see the posterior border. The posterior border rests over the sternocleidomastoid. This is your sternocleidomastoid, this yellow one, right? So it is resting over the sternocleidomastoid. Now what are the structures radiating from this border? First is your posterior auricular nerve and vessels. Posterior auricular nerve and vessels, right? Then is your posterior auricular branch of facial nerve. Posterior auricular branch of your facial nerve. Understood? Now let's see the last border. Last border is behind. That is your medial border. Deep down, sometimes this border extends to the pharynx, and there it is called as pharyngeal border. There it is called as pharyngeal border. Now let's see the surfaces. The surfaces are, so first is the superficial surface. The superficial surface is covered by the skin, superficial fascia, posterior fibers of platysma, and the superficial lamella of the parotid sheath. I'll discuss this later, okay? And related to the superficial fascia, there are superficial groups of parotid lymph nodes which are present over this, with the branches of the greater auricular nerve. I hope it is clear. Right. Now let's see the enteromedial surface. I'm reverting this back. Right. This is the enteromedial surface. Now enteromedial surface is related with this structure, with this area of the parotid region. Right. So the first is, it is related to the posterior inferior part of the masseter. Which muscle is this? Masseter. Posterior inferior part of masseter. Right. Then posterior border of mandible ramus with a capsule of temporomandibular joint. With the capsule of temporomandibular joint. Then there is a medial pterygoid muscle. This muscle is your medial pterygoid muscle. Clear? This is posterior belly. This is medial pterygoid. So, muscle relating to the enteromedial surface is medial pterygoid muscle near its insertion. Right? And outer lip of the groove transfers the branches of the facial nerve. So, these are the structures which are related with the enteromedial surface. Now, what are the structures related to the posteromedial surface? It is extensive. Now, this is the surface, right? And it is extensive. Now, what are the structures related? First is the mastoid process, right? With the sternocleidomastoid. I have removed the sternocleidomastoid from here. It is like this, right? And the posterior belly of digastric. This is posterior belly of digastric. With styloid process. This is sternocleidomastoid, posterior belly of digastric, and the styloid process with styloid apparatus. Clear? Styloid apparatus includes the muscles attaching over the styloid process, and the ligaments. Now deep to the styloid process, deep down to the styloid process, the other structures which are present is the sternocleidomastoid muscle, I'm extremely sorry, internal carotid artery in front and internal jugular vein behind. And between these structures, means the internal carotid artery and the internal jugular vein, the 4 cranial nerves intervene between them. Those are 9th, 10th, 11th and 12th. I hope it is clear, right? So these are the relations of the posterior-medial surface, right? This is the... Now what are the structures which are passing through the gland, right? Through the, inside the gland. They are inside the parenchyma of the gland, right? The first is the, means above downwards. The first structure which is present just below the surface in the parenchyma is the facial nerve. The branches of the facial nerve itself and the branches of the facial nerve, right? Extracranial part of the facial nerve. Next, behind to it, more deeper, is the retromandibular vein. And most deepest part is your external carotid artery. The most deepest is external carotid artery. Now in the end, let's little talk about the capsule of your parotid gland. The capsule, the gland is invested by an inner true and outer false capsule. If I talk about the true capsule, it is formed by the condensation of the fibrous stroma of the gland. And if I talk about the false capsule, the false capsule or the parotid sheath is formed by the splitting of a deep cervical fascia, that is investing layer of deep cervical fascia. Now it gets split here. This, above one splitting part, that is superficial lamella, goes above like this, right? And the deeper one is thin, goes behind. The superficial lamella attaches to the lower arch of the zygomatic arch. This is your zygomatic arch, clear? This is your zygomatic bone, and there is an extension of zygomatic arch. So to the lower border of the zygomatic arch, okay, lower margin, and down below it attaches, it merges with the epimysium of the masseter to form a massetero-parotidic fascia, or you can say parotido-masseteric fascia, which is the thickest one, right? And if I talk about the posterior lamella, deep lamella, which is thin, I have to remove this, goes backward towards the tympanic plate. I hope you can appreciate this area. This is your tympanic plate. It goes to the tympanic plate down there and to the styloid apparatus, styloid process. From the styloid process, this deep fascia, this deep layer of the fascia gets thickened, and from there it attaches, goes to the angle of the mandible, and it gets thickened and also known as stylomandibular ligament. And this is the cause why, if there is a parotid swelling, the fascia doesn't allow to expand the parotid gland, for allowing the expansion of the parotid gland, and this causes an extreme pain in patient, right? Extreme pain at this region. Thank you very much.